Stop. All right, Madam Administrator, let me know when you're all set. Perfect, thank you. So good afternoon, everybody. We're going to call the Appropriations and Public Health Committee's public hearing on the FY23 Tobacco Health Trust Fund Plan. Let's see if there's anybody who has anything. Madam, no,
Good afternoon.
Senator Berthel.
Good afternoon.
For Public Health, it's Senator Anwar. Who is the chair, House Chair?
Yeah, so
Here we go. Do you have anything to say to start this meeting off? No? Are you the ranking member?
Yes.
Do you have anything you would like to say?
Welcome, everybody. Let's go.
Let's go. All right. I haven't had anybody say they wanted to say anything, so let's go. So up first is Claudio Gualtieri, the Senior Policy Advisor to the Secretary of the Office of Policy Management, to talk about the Tobacco Health Trust Fund Plan. Claudio, the floor is yours.
Thank you, Senator. Good afternoon, distinguished chairs and members of the Appropriations and Public Health Committee. My name is Claudio Gualtieri, and I'm the Senior Advisor for the OPM Secretary, and in my capacity here today as Chair of the Tobacco and Health Trust Fund Board. I also want to acknowledge my fellow board member, Representative Harrison, who's been in the trenches with us developing today's plan. Just to set some context and history on the board, today marks a significant milestone, many years in the making, that first rebuilt our Tobacco and Health Trust Fund Board after a period of 5 years of being insolvent. It reestablished and makes a firm commitment to comprehensive funding for nicotine and tobacco control programs. And with the help of legislators, many of which are here today, we modernized our mission so that we can take into account vaping, e-cigarettes, and synthetic nicotine products that have subsequently become a major concern, especially among our youth. The allocation plan recommends disbursement of the entire $12 million that's available to us. To put that into context, this is the largest single allotment of money in the Tobacco Trust Fund's history. And further, the $12 million would represent about 40% of the entire funding for tobacco cessation from 2000, when the board was initially started, all the way through till 2018 when it was sunset. So a significant plan is before you, and it really represents a major commitment in this space. Really quickly, I know DC Terranova from DPH will talk in depth about some of the funding categories, but we did allocate to each of the 5 CDC best practice categories. Those categories include cessation intervention at 40%, state and community intervention is the next at 35%. There's lesser amounts for mass communication outreach and surveillance and evaluation, and finally a small amount for administration and management. As has been past practice, the board is recommending to do competitive RFPs to award the funding as part of this plan, except for 2 activities that I'll describe briefly. The first of those dedicated investments is for the quit line. The board recommends $100,000 be dedicated to the quit line. This is a free stop smoking service available to Connecticut residents through telephone, and it provides cessation counseling and nicotine replacement for those who need it, such as patches, gums, and lozenges. The second dedicated source of funding is for DPH to operationalize the RFP process, to do the grant making, and to do the oversight to make sure that the funds get out to the providers that win the bids. I'm very happy to say that this plan before you received the unanimous support of the Trust Fund Board, and we believe it's a very efficient way and effective way to spend the resources we've been allotted. Specifically, it relies on evidence-based practices. We fund according to the CDC categories and in proportion to what the CDC recommends for those monies. It honors all of our statutory commitments and the priorities the legislature has tasked us with. It uses a competitive bid process, which I think will help spark some innovation and creativity in this work so that we're not just doing the same stale projects year over year. There'll be a competitive process, and our board members have agreed to serve on the evaluation panel to give input and guide that process. It also maintains the quit line, as I mentioned, and for benefit of Representative McCarthy Vahey, I'll do a PSA announcement and say 1-800-QUIT NOW. Anyone who needs help, Spanish, English, and it's available to help 24/7. And then finally, and I think this is very important, is we dedicate money to looking at an independent evaluator to see that these resources are being spent wisely and effectively and doing what we intended them to do. This evaluation component was very important for us because the last thing that the prior board did in 2017 was set aside some money to do a retrospective and to say what has worked over the period of 18 years that the board had been meeting. And that was the foundational product that we could pick up on. It was the institutional knowledge. I see us sort of paying it forward by making that commitment here that we're going to evaluate our programs, pivot, shift, scale up things that work, change things that don't. And it's another strong part of, I think, our plan today. So I respectfully ask for your support. I'm here to answer any questions, as is DPH for specifics on CDC. Thank you.
Thank you, Claudio. So let's see if anybody has any questions. And you said that we had a dedicated amount for the quit line of 500,000, and then you said you had a dedicated amount for DPH, but I didn't hear the dollar amount.
Thank you, Senator Austin. It's 525,000, which represents the 4% under our administrative category.
And what will they do with that?
That's for running the RFP process, helping to do the evaluation committee, doing contract management, grant making.
And how many people does that equate to? Do you know?
They're suggesting 2, DC Terra Nova, and she could talk a little bit more about the procurement process that they plan to operationalize.
Thank you. And then for the record, how big is the board?
17 members. And Senator Austin, if you give me a point of personal privilege, we still have 3 vacancies. So we do very exciting work. And if people want to still get involved and engaged, we have 3 appointments and we can circulate that to Madam Administrator afterwards.
And where are those? Do you know who those 3 vacancies belong to?
Yes, the House Majority Leader has 1, the Senate Minority Leader has 1, and the Senate President has 1.
And are they qualified in any way?
Nope.
So they're open-ended?
We asked, though, the only qualification is that if you represent an organization that may subsequently bid, you know, that would be a conflict of interest. So as long as there's no conflict of interest, there's an interest there, then you can be part of it.
All right. Thank you for that. Representative Walker, do you have any questions?
Yes, I just want to dig a little bit deeper into the 525,000 for DPH. Or should I wait for DPH to come up, or is this a time to ask DPH questions?
You may want to wait for DPH, I think, is immediately following me.
Okay, I'll wait.
What I will say, if it helps on setting context, is how we came up with that number is the CDC does recommend a portion go to administration, and that was the 4%, and that's the number we used. We also looked at our block grants to make sure that wasn't out of line with what we do for block grants.
Okay.
And to give you context, LIHEAP is 10% typically, and CSBG is around 4%. So we went with the lower of what we've done with block grants and what was recommended by the CDC. That's how we came up with the 4%.
Then maybe I can, so 4% of the allotment is for DPH. The 500,000 for the quit line is 5%. Is that what was that percentage? Was that percentage?
Quit line is roughly about 4% too.
Yeah.
Roughly about the same, within a
Right.
rounding of a few decimals.
Okay. Okay, so those are 2 things. You said there were 4 or 5 categories. What were the other categories?
So the 5 broad categories are cessation intervention. Quit line would fall under that, and we've dedicated a line item of 500,000 for quit line. The second broad category is state and community intervention. Think of this as like school-based programming, Boys and Girls Club, community-based programs that help people keep healthy and stay active so they don't smoke.
How much are you putting into that?
That's 35% or 4.23 million, almost 4.275.
4.23, 4.2.
The third is for mass communications and outreach. So think about public service announcements, advertisement, Facebook, Twitter. We're also thinking of potentially doing some strategies around gas stations where you hear, you know, advertisements piped in because that's a point of purchase. So if we can help deter people, that might be a good spot. The fourth is the surveillance and evaluation. That's 9%, just over $1 million. And then the fifth is the one that's for DPH, which is the admin costs.
Okay, let me just make sure I got this. We got the quick line for 500, which is about 5%. RFP, DPH, that's about 5% or 4%, whatever. Then 35% goes to, is that marketing or just advertising?
No,
Mass communication?
the 35% is for those after-school and youth programs, Boys and Girls Club. That's the state and community intervention
Okay, so it's
category.
community intervention. And then advertising is, what's that?
12%.
12? Okay. And then the final was the,
Surveillance and evaluation, 9%. Did you get that one?
okay. Okay, thank you.
Great.
Thank you, Madam Chair.
Just for clarification, the cessation is not just 500,000, is it not? What is the total percentage there?
Yes, it's 40%, $4.762 million. Of that, 500 is earmarked for the quit line.
Yeah, I just wanted to make sure
Yep.
that we had,
Yeah, we didn't have that.
in the mass communication, one is 12%, and what is that dollar amount?
Dollar amount, 1.387 million.
Thank you. Are you all set?
Yes.
It's Senator Anwar?
Thank you so much, Madam Chair. Thank you so much for your testimony. I just wanted to mention, if you look at the trajectory of the number of our children who are now getting addicted to nicotine-based products, that trajectory is increasing, and the CDC has recommended far more dollar amount. I like the idea that we are using proven strategies to try and have a control over it, but we are not able to keep up with what the CDC has recommended at the present time and going forward as well. And we are seeing the results of that. And if you look at the opposite marketing, it is multifold more than what we are actually investing to prevent it. So the industry is putting $55 million, and then we just finally have been able to get to a 12 million, which also took a lot of activity and action and the responsibility from this committee to be able to address. So we need to make sure that there's a commitment of more amount to at least be at the lowest level that the CDC has recommended. So how would we be able to achieve that from your office's perspective?
So two perspectives on that. One, I believe very strongly that the board we have in place now is an active, very engaged board that can be a conduit for us exercising, getting federal grants, federal resources, and other opportunities from private charity, which is allowed by the trust. And quite frankly, I think that's the strategic direction we need to move in. So we're not solely dependent. We need to diversify our revenue sources. So if a bad budget year comes, we don't get wiped out again. And I'm actively going to be looking for help of the board over the summer to create a strategy for how do we go after federal grant opportunities, nonprofit, charitable things to supplement whatever resources we get from the state. Secondly, I would point out that I would not characterize the money we spend for cessation as only being this trust fund. Connecticut does some really great things in our Medicaid programs through federal block grants and through other initiatives. Cessation is built into some parts of our Medicaid program. Those dollars aren't getting rolled up and seen by some of the advocates who are trying to benchmark us to the 22.7 million. So we do really need to take a holistic look when we compare about all that Connecticut does for cessation as compared to our comparing states.
This is my second question, which is basically the same point, that we're losing the bigger battle with the money that we have. And that's the ground reality. You may have the best board in the world, but as of now, right now, the results are not in our favor. That's what we have to figure out how to address that. Thank you so much.
So not really a question, just a statement,
Yeah.
Senator, because there was no question in that, was there? No, thank you. Appreciate that. Representative McCarthy Vahey, followed by Representative Nuccio.
Thank you very much, Madam Chair. It's wonderful to be here together with the Appropriations Committee. And Claudio, thank you for your good work with the trust. And thanks to all the members of the group, our Department of Public Health. This is really, really important work. And I think you know that Senator Anwar and I are deeply committed to this. One of the clarifying questions I'd like to ask of you is, typically or traditionally, when we look at the money and the utilization for these funds, we're thinking about cigarettes. Can you talk a little bit about the new technologies that are being used to help people get addicted to nicotine and the group's role in addressing those technologies and those utilization opportunities, I guess? It's probably a bad way to put it.
No, and I'm glad you did that because you give me an opportunity to call out the Public Act that we worked so closely with you and Senator Anwar on last year, which was 2292, that upgraded and allowed us to focus in on the vaping products. And I think that, including flavored vapes, is becoming a point of addiction for a lot of our young members. And that's something that the board, through our competitive process, will be calling out, looking at the new synthetic cigarettes that are out there, vaping products, and trying to get interventions that may be more appropriate for that than some of the old strategies we use for combustible tobacco.
I appreciate that. I also just wanted to know if you could share with us how much money we have received from the settlement over time and how much the CDC recommends as a minimum that we invest. I should have given you these questions ahead
Sure.
of time, but
No,
I know they're not trick questions for you.
I anticipated as much, Representative McCarthy-Vahey. So the National Association of Attorney Generals does the management and making sure that the master settlement agreement is followed through with, and they keep charts dating back from the inception. So Connecticut, over the entirety of the master settlement agreement, has received about $3.1 billion. Last year's deposit was about just shy of 125 million, 124.7. And I can share, if it's of interest, we can certainly share the chart that has it documented year over year and how it changed over time.
Of that $3.1 billion, how much of that money has been spent directly in efforts like this and in allocations such as this one?
So again, I'll say that some of it is embedded in programs like Medicaid, which are commingled and impossible to tangle out. Specifically, the Tobacco and Health Trust Fund, 29.9 million, about 30 million when it was in existence from 2000 to 2018.
Thank you. And we've had lots of these conversations privately. I bring that out into this conversation as well, just to remind us of the staggering difference between what we've received and what we've actually spent directly. And I appreciate your point. It is impossible to untangle. I also just
Okay.
parallel.
So we got other people?
Yes,
On
yeah.
appropriations, we do the two.
Okay, gotcha. Thank
So,
you.
I'm sorry.
No, don't be sorry. I
You
appreciate,
can come back. I will
I
come back
appreciate
to
your
you.
answers. Thank you.
Thank you. Up next is Representative Nuccio.
Thank you, Madam Chair. It's nice to hear everybody's voice. I kind of want to partner up here with what Representative McCarthy-Vahey was just saying. I've been arguing for these dollars since my first year here at the legislature. And the amount that we're actually, I believe we get, including tax for cigarettes, it's about $384 million a year that comes in from the profit of people smoking.
Representative Nuccio, it's hard to hear you, so I don't know if you can get a little closer to your mic.
Sorry, is that better?
That's a little better, yep.
Okay, sorry. I just find it a little concerning. I believe the number is around 384 million that the state of Connecticut receives from the tobacco settlement and the incoming taxes that we charge for cigarettes themselves. And we seem to be spending, $12 million is a drop in the bucket. So my question for you, Claudio, is I'm very happy that 35% of this is going to the towns and education, but I just feel like that is even woefully inadequate. I'd like to understand on a town by town basis how much each town gets with that, because I think on average, one of my towns maybe gets a couple $1,000s, which really is not an adequate amount of money to be able to create programming for school age children on the hazards of smoking and vaping. So I'd be really interested to see what the town runs look like, if every town gets this and what numbers they are. And then what appetite does the committee have to increasing that number so we can actually fight this on the ground where it's happening?
So for the first one, you give me an opportunity to clarify to make sure that we're all clear on this, is that the broad-based category is for state and community interventions, but no items have been designated specifically to any towns, and it's not guaranteed that every town would get it. Exactly for the purpose that you just alluded to, which is it would so dilute the pot that no one would be able to put on a meaningful program. So we have instead recommended a competitive process has been done in the past. So towns in partnership with nonprofits and community organizations could put together a proposal that would win the necessary funds to actually do a meaningful program.
So I see, I guess that's where I have a problem then, right? Because smoking isn't only in certain towns who can fill out grants and win a grant proposal, right? This is something that is affecting every town. It's affecting rural Connecticut just as much, if not more, than it affects the cities in Connecticut. So I struggle with that, especially knowing the kind of money that the state pulls in from smoking, to see that not every town will benefit from this. So kids in my rural eastern part of Connecticut may get nothing because they don't qualify through some grant process that somebody's putting in place. So I have a fundamental issue with that. And that's really all I have right now, Madam Chair.
Madam Chair, may I respond?
Yes, Mr. Gualtieri, you may certainly respond.
Thanks, Representative Nuccio. Just to be clear, though, that is for one part of it. So we see a lot of this being statewide. So communications efforts and outreach would be statewide. Certainly anyone who puts together after-school programming, they could have reach far beyond, and that's going to be a priority. So in addition to the categories, the legislature has tasked us with awarding certain grants based on different levels of priority, one of which is looking at the different disparate uses across towns and making sure that there's equity in distributing these resources. There's also prioritization given to try to make sure that youth don't initiate and cessation programs for both youth and adults. So we're going to have a layered approach in the RFP where we could unpack that and make sure that many of these interventions are statewide, regardless of whether a group in your town chooses to apply for and win a competitive grant. And so I would just assure you that much of our focus here will be on a statewide, like Quitline, for example. These cessation interventions will be open to the entirety of Connecticut, and that's the largest pot of money, the cessation interventions.
Representative Nuccio, does that help you clarify any of what?
It gives me some information, but I still just have some concern without knowing how this could be.
So first of all, I want to
great,
say,
but that's mainly more adults,
so we want to welcome you back, Representative Nuccio. It's good to hear from you. Thank you very much for coming on today. And I know that we'll have a lot more words as we move forward, but it's a real pleasure to hear your voice.
It's so good to hear you guys too. Thank you.
Representative Claritas Detria.
Thank you, Madam Chair. Thank you, Claudia, for over here. Nice to see you. Can you, for people listening or some of us up here, the excuse me, the 1,050,000 for surveillance and evaluation, what does that really go to, and why is it so high?
So typically we'd look for an independent academic validator to look at across the board. What did we award funding for? How many people were served? Was it the most effective use? And they would do an analysis on what was the return on investment for that. For example, in the past, we've hired University of North Carolina was the one that did our retrospective, and they were critical. There were some things they said were very good, like Quitline. That's why we're recommending that for a dedicated resource. But they also said some things didn't really make the mark. They didn't make as much effort. And I think it's very important when knowing we don't have infinite number of dollars that we have a third party, not connected to any project, not connected to the policy making in our state, but just an objective observer that's going to look at metrics and tell us what's working and what's not. And consultant costs like that are costly, unfortunately.
All right. Thank you so much for the clarification.
Thank you.
All set, Representative?
Yes.
Thank you. Up next is Representative Dillon with only 2 questions.
It's so nice to see you, Senator.
Everybody says that to me.
I want to credit Representative Candelaria for forcing this issue in the Health Subcommittee, and you and I haven't had any conversations on this topic at all, 0. So I want to say as strongly as possible that when we're talking about marketing, that we take, and I've seen this problem in many different departments, unfortunately, at the state level, that we have bilingual outreach. The emerging community, certainly in New Haven and but statewide, is Latino. Plurality is Puerto Rican, but not only. And it was partly because of a loss in that community that Representative Candelaria was absolutely intransigent on making sure that these dollars were dedicated, and he was right. And I think we should honor that and not have kind of a bleached out, kind of bland thing. I think we need to think about how to reach different populations. Have we got a plan to do that?
Yes, Representative Dillon, thank you for that. That is one of the legislative priorities. So as part of the RFP process, when we're granting out based on tiering, we'd want to show that there's an ability to reach hard to reach communities. Bilingualism will certainly be part of that. The CT Quit line, which we do fund, has dedicated both brochures and help guides and speakers and coaches who are both Spanish and English. It's a very intentional part. And I think because it was codified in 2022, it'll be even more apparent as we get through this next round of grant making. And I do appreciate the work that both you and Representative Candelaria did to make sure that
He's been
doesn't get
awesome.
lost.
And then follow-up question or nested question, when you do the evaluation, I assume that you have a measurable evaluation as well of outreach to communities that don't have English as a first language.
That part will also be built into our solicitation around the evaluator piece, the surveillance and evaluator piece. Yes.
Thank you. That's it.
Thank you.
Thank you very much, Representative. Up next is Representative Belinsky. Representative Belinsky, did I lose you?
Yes.
All righty, when he comes back on, we'll go back to him. Representative Mara?
Thank you so much, Madam Chair. Thank you for giving your testimony today. I read through everything that you sent. I've had some thinking on this. Now, just a question about when you talk about smoking cessation, I know you're looking at this as a holistic view, but I think it only mentions tobacco and nicotine. Are we not considering other things that you could smoke that would be unhealthy as well?
Thank you, Representative Mara. Our legislative charge specifically calls out combustible tobacco and nicotine addiction. So we'll have to stick to the legislative charge when awarding these dollars. I think our intention was in the past, the scope of available reinvestments was much broader, and it included things that had nothing to do with tobacco or tobacco smoking or nicotine addiction. And people thought that diluted the purpose of these funds. So the intentional decision was made to refocus us solely on those areas for now. I will say that the Juul settlement does allow for a pass-through of funds. Attorney General Tong was able to win a $16 million award that's coming to Connecticut, the first tranche of which is $1.5 million. And those funds are going to the regional behavioral health action organizations, which do broader-based substance use and addiction services. It'll be grants of $300,000 this year that DEMIS is working to operationalize. And in September, they'll come back to our tobacco board and report on how did that money work and what's the next tranche look like.
Okay, so if I can just clarify then, it sounds like right now it only includes tobacco and nicotine, but understanding that this is kind of a bit of an insincere approach if we don't include everything that we smoke and put into our body, you are looking at, if possible grants come in the future, that you might be able to change and pivot and add that into your education.
So I'm going to step in and say, I don't know that I would say it's an insincere approach because we have the other settlement on Juul, but we also have an opioid settlement dollars. So we are bringing in a lot of dollars that will deal with a lot of things that we smoke. But when we, like the opioid would be essentially for anything relative to opioid addiction. And we all know that there's other addictions that are out there that includes any of the opium kinds of things like fentanyl and other things, and the Jewel is one of those things. So I don't know that I would characterize it as an insincere approach. I would characterize it as a bifurcated approach that looks at different things with different pots of money. And should we talk to the board of the tobacco settlement board that we have and say to them, hey, listen, we've done a really good job of addressing some of the issues relative to tobacco and nicotine. And I wish that everybody that smoked tobacco had my reaction when I first smoked some 50 years ago and became ill. I'm dating myself, but you know, we all know that that's not true. But I don't know that I would say, you know, that it would be insincere. I think that we have a certain dollar amount, we have to spend that certain dollar amount. And right now the certain dollar amount is dedicated for that. But if we're really good at getting some of the things tamped down, then maybe we'll have another discussion.
Can I just reframe my question then?
Yes.
Okay, thank you. And I appreciate that, and that's fair enough. I think looking at it when we're looking at smoking cessation and the people that we are focused on, I think a population would be very similar to those that may be looking to go through tobacco cessation as maybe wanting to also go through cannabis cessation. And, you know, a lot of the messaging would be similar. So I think that's how I'm looking at it, that this would be a similar population. That's why it seems like to me it'd be easy to add in because you're targeting that same population. But, thank you.
Yeah, just linking on to Senator Austin's very good point is that there are a number of different settlement groups or boards, including a cannabis equity fund that's doing a lot of reinvestment and education around that. I think our approach as a board has been to connect the dots. So that's advice well taken. It happens in different pieces, but if there's a coordinated effort, and one of the things that we award on is based on, can you braid in other funds? You get extra points for that. And that's where we want to sort of be.
Yeah, thank you so much.
Thank you.
Thank you. I'm going to go back to Representative Belinsky. Mr. Belinsky, Representative Belinsky.
Thank you very much, Madam Chair. I apologize for my computer disconnecting me, and I'll be quick on this one, I promise. First of all, I just want to say and echo what my fellow representatives have said before me, and also repeat a warm welcome for Rep. Nuccio, and thank Rep. Candelaria for his outstanding efforts. But you know, the simple common sense part of this, you know, Claudio, and thank you so much for helping us develop this plan. For every dollar of cessation that's spent, according to the American Lung Association, there's $5 saved in public benefit, or, you know, the cost that we spend as a government on, you know, on people that are dying from lung cancer in this particular case, you know, solely from tobacco. You know, another number that's thrown around, every time you go to a store that sells cigarettes, there's a sign that they're required to post that says that 1,200 people a day die from smoking related lung cancer every day in the United States of America. So if you extrapolate that out very, 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 very simply, that would mean that we have 12 to 13 people a day dying in the state of Connecticut. Yet, for my entire tenure here, every time we've had an opportunity to vote on settlement money, we see it swept away. And you know, I just find that to be a really bad return on investment. When, you know, even taking the human element out of it, I just don't understand how we think that it's a good idea not to be investing every dime of what we're getting in this settlement to cessation efforts. And, you know, frankly, I don't make a distinction between anything that happens on the local level. I think that we probably are going to be way more effective if we just, you know, absolutely tackle this as a state. Claudio, how do we get to a point where we really, really take this, with the gravity that it deserves, and not only start saving lives, but also taxpayer money.
So first, Representative Belinsky, let me say thank you for reminding us and reflecting why we really do this work and the people behind the allocation plan. I mean, we're talking a lot about numbers and programs, and you did a great job of recentering the conversation, and our focus should be top of mind on the people who are in danger or at risk. And we really need to have that front and center as we implement this allocation plan. To your point about return on investment, I think the best thing we can do, and what I'm so excited about in this plan, is it's going to put the numbers and the data behind the theory and the case that you've just presented, which is if we can show through independent third-party evaluation that what we're doing is working. This isn't putting, an advertisement in the middle of a field that no one's seeing, and it's not moving anyone off of smoking, but it's instead really providing direct services. It's getting people off of smoking. It's providing that support. It's providing the community and youth programming that we need to keep kids healthy and off of smoking. Then we'll have a body of evidence that will inform legislators, administrations, and the public generally of where the investments need to go and what we can get out of them. So I think part of our duty as a board is to build that use case and give you guys the data to make informed decisions of how to tackle the gravity of the issue in its entirety.
Thank you so much for that. I look around the country and I see best practices in other states, and I see other states, that might be a little tiny bit ahead of us as far as this thinking. So I hope that, getting to the point where we actually use every dollar we can to saving lives and preventing, the illness, is really, really important to me. And that doesn't require a response. I thank you for finding a way to get us there, please. Thank you, Madam Chair. I appreciate.
Thank you, Representative Belinsky. Appreciate it. I see no other questions for you. Claudio may see a couple more questions come up, so if you wouldn't mind hanging out. We're going to go right now to Bright Johnson. I believe that we're trying to get you in, and we'll come back to Jody Terranova. Thank you. Bright is a member of the public from the American Cancer Society, Connecticut Government Relations Director. Sir, go ahead.
Thank you very much. I really appreciate the accommodation of letting me speak out of turn. Good afternoon. I'm Brett Johnson, Connecticut Government Relations Director for the American Cancer Society Cancer Action Network. Thank you for allowing us to comment on the fiscal 23 Tobacco and Health Trust Fund allocation plan. We have submitted written testimony in strong support of the board's recommendations, and we thank the board members and staff for their thoughtful deliberations and hard work. However, what should be a day of celebration as this joint committee meets for this purpose for the first time since the Obama administration, instead, we find ourselves once again before you hat in hand to urge you not to harm progress because of the process. Despite the clear intent of the General Assembly in 2022 to provide continuous, ongoing, and appropriate annual funding for tobacco control programs, the budget revision before the legislature this year would suspend the 2025 annual deposit of $12 million for 1 year. This suspension, just as implementation is underway, is due to the time it took to reconstitute the Tobacco and Health Trust Fund Board. The budget that restored tobacco control funding for the first time in 7 years passed in June of 2022. The first funding of $12 million was made available 10 months later in 2023 as part of the annual master settlement deposit that takes place every April. The Tobacco and Health Trust Fund Board was reconstituted over the interim and allocated all $12 million of available FY23 funding last month. That's what we're talking about today. For the moment then, the work of the board is already all caught up. The second round of annual funding of $12 million for fiscal 24 will not be available for allocation until April of this year. Again, because that's when the MSA payment takes place. So even if the board scheduled a meeting for tomorrow, they can't allocate money that isn't available yet. Once the 24 funds drop, the board can make recommendations for allocation theoretically before the end of this legislative session. Any future funding couldn't occur again until April of 2025. In the meantime, RFPs will be going out, operationalizing existing funding and providing time to learn from the experience of that funding. If enacted, this suspension of 12 million for fiscal 25 would be the 84th time the fund has been swept, cut, reduced, or redirected in its 22-year history. Continuity of services and programs is essential as not everyone reacts or benefits the same way from utilizing the various FDA-approved quit methods. Some take longer to be able to quit. Some react better to some therapies, for example, than others. Interruption in services due to fluctuating funding will only exacerbate the problem and reduce the number of people that would benefit. We are not asking for a new funding source or to create new bureaucracy, only to utilize a portion of that which comes to this state every year for this very purpose. We applaud these committees for making a strong public health statement that not only should funding that follows CDC best practices continue, but we are asking that it be increased to 22.7 million annually, the minimum level recommended by the CDC. Please don't let Connecticut fail us once again by inadequately funding proven strategies intended to reverse this entirely preventable problem. Thank you for your time, and I desperately would love to answer questions.
Well, seeing as you're out of sequence in this way, we'll have a couple questions, but we have to get back to our agency stuff. Representative Hoxsey, you had a question?
Yes, Madam.
Question?
Yes, Madam Chair. Thank you very much. Through you, just a question for the gentleman testifying right now. You use the term master settlement deposit. Can you explain a little bit what that is and kind of the history of that?
Of course, yes. 22 years ago, 46 states' attorneys general filed suit against the 5 largest tobacco companies. Before it went to trial, ultimately, and after a significant amount of negotiations, they agreed to settle out of court. And the settlement is called the Master Settlement Agreement. And basically, that requires the big 5 tobacco companies to pay each state for their share of the healthcare costs relating to tobacco use. And so in perpetuity, Big Tobacco pays Connecticut about, it fluctuates somewhat, but about 110 million each and every year, going back 22 years now, and into the future in perpetuity. The intent of the master settlement, the intent of that payment is to help offset healthcare related costs for tobacco use. The flaw in the master settlement is that the language says that that funding may be used for that purpose, not shall be used for that purpose. So it's $110 million of free money that comes to the state, which is why it's been redirected and swept as many times as it has been over the 20 years. All 4 governors that have presided in this state since the agreement was agreed to have made cuts to this. And over the history of it, we've received barely 1% of the total amount of money that's been deposited for this purpose.
All set, Representative? Thank you. Representative Dathan?
Thank you very much, Madam Chair, and through you. You had mentioned that the CDC recommended a minimum of 22.7 million. What is the full funding that the CDC recommends?
The full funding is 32 million annually. And up until this very moment, if you add up all the money that we have dedicated to this cumulatively over 22 years, it doesn't amount to 32 million, which is what we should be spending annually.
That was going to be my next question. Yeah. So I'm going to use my second question is, does the American Cancer Society or the American Heart Association have an estimate on how much our state pays for tobacco-related illnesses as a result in Medicaid as a result of tobacco use? Or Medicaid, either treatments or other things?
Through Medicaid, it's the last I saw was about $500 million annually. Overall, it's 2.03 billion annually in healthcare costs, which amounts to about $175,000 every hour of every single day. And over the course of this hearing, statistically speaking, somebody is going to die from tobacco use. It averages about 13 a day. 4,900 a year.
So this is really an economic investment to lessen our Medicaid costs
So,
in the future. Thank you very
Representative
much,
Dathan,
Madam
I
Chair.
see you going on to the next one. If you think I didn't catch that, I did, but I appreciate what you had to say. Thank you.
Thank you.
Up next is Representative Nuccio, followed by Senator Onmore.
Thank you, Madam Chair. Can you hear me okay?
Yes, we can.
Okay, so I have a two-part question, but I think one part is going to be for you, Senator Austin and Representative Walker. The first part, though, is to the gentleman. Thank you very much for bringing the 32 million forward. This is the number that I've been pretty much fighting for since my first year in the legislature here. And I would just like your review of what we heard from Claudio in regard to the grants that are going to be given for educational purposes and such to the towns. Do you feel the program that we have in place right now is going to be adequate, or do you are you more in line with every town should see a benefit from this to continue education and prevent children and young adults from ever starting to smoke?
Is it adequate? It is what it is. Adequate would be probably at least 22.7 million or 32 million, which is what the CDC recommends.
No,
This-
not that part. That
Oh.
part I get. I agree with you on the 32 million. I meant in particular in regards to having a grant program rather than this money going out to every single town to be used for education purposes. Do you think that it is a fair program to say we're just going to give it to a few towns with grants, or should this be something that we should be looking at hitting every one of the 169 towns in the state?
I think there's always opportunity to improve the process, no question. But again, given that this board, I think put in some very thoughtful deliberations in coming up with the funding levels spread across all of the CDC best practice buckets. That was critical. I think that's a crucial component of this. And given that they have expended the full 12 million that's allowable, I think that these numbers are pretty good. I would love to see much more money spent on this issue. Florida has a constitutional amendment that requires a specific percentage of the funding that they receive from the master settlement to go towards tobacco control. And it's over $80 million. Granted, they have a much larger state and a much greater population, but the fact that it's a constitutional amendment, that this money is dedicated each and every year is, I think, fantastic. I would love to see something like that. We have argued for years that tobacco control should have a line item in the budget here in Connecticut. It doesn't. And in 2017, there was one line in the budget implementer, and that line was as followed. It said, the annual transfer of funding from the Tobacco Settlement Fund to the Tobacco and Health Trust Fund will be permanently suspended moving forward. That one line, if you didn't know what that line meant, you didn't know that you just canceled tobacco control for the entire state. And it took us 7 years to get this money back. And while I would love for there to be enough money to be able to cover everything that is smoked and everything that is dangerous, there isn't by any means. Unfortunately, whether you agree with allowing cannabis to be sold recreationally in this state or not, the language that created that statute does have funding available as a shall, not a may, funding to deal with the use of cannabis. We don't have that luxury with this. So whatever funding we are able to flip cushions over and find, we need to make sure it's dedicated to tobacco use, to eradicating it, to helping people quit, and helping prevent children from ever starting.
I would agree. And I would say that an increase from the 12 million to the 32 million would enable us to give every town dollars to start to have programming like that for children. So my second question then, and this is kind of more like something that I'm going to want to poke and prod at, and I think I have in the past. I'm a little foggy right now, but Senator Austin and Representative Walker, I believe the revenue that comes in for this is off books. It's not in our general revenue stream. So I think if we were to, pardon me?
It is in our general revenue stream. It goes to support other programs that are in the general fund. It doesn't go to transportation, but it goes to Medicaid expenses, it goes to other expenses like the health districts. A portion of all of that goes, it's embedded in our budget, and that's how normally how the state has gotten to the point where they were not doing this dedicated trust fund expenditure. That's when we were cutting programs. I would go back, I think this happened around the 2017 budget year. And when we were cutting programs all over the place, we dedicated the money that we were getting into Medicaid, into health districts, and into other areas. So it does field its way through the general fund in its entirety. And that's when they were making a report back to the master settlement. That's what the state was including in the master settlement expenditures, was things like the Medicaid line items relative to cessation and other healthcare issues. So
Okay, I think when we were debating this on the floor a couple of years ago, I asked specifically, and then the revenue was coming in and it was kept in a quote unquote like off books kind of area, then filtered, as you said, through the general expense for other items. But I think my question is really, does that revenue in the spending come under the cap? If we were to say we want more than 12 million
Yes, it
into
is-
this
it is-
fund,
Yeah, it is under the cap. It is counted under the cap.
it is. Okay, all right, thank you very much.
Thank you. Senator Anwar?
Thank you so much, Madam Chair. Bright, thank you for your testimony and the numbers. Is there any state, you mentioned Florida, is there any state that's doing this right?
Yeah, there's, like I said, Florida has a constitutional requirement to spend a significant amount of dollars on tobacco control. I'll give you some examples of other states that have seen success with this. In Washington State, the state's tobacco control program cut adult smoking by a third and youth smoking in half, and prevented an estimated 13,000 premature deaths and nearly 36,000 hospitalizations, saving about 1.5 billion in healthcare costs. Additionally, the state saw a 5-to-1 saving with their program between 2000 and 2009. In California, lung cancer rates declined by a third between 1988 and 2011, reducing lung and bronchus cancer rates 4 times faster than the rest of the United States. In addition, California saw a $55 to $1 return on investment between 1989 and 2008. Alaska, which is one of only 2 states to fully fund according to the CDC recommendations, has cut its high school smoking rate by 70% since 1995. Maine has reduced its youth smoking rates by 2/3 between 1997 and 2013. And from 2009 to 2015, smoking among North Dakota's high school students fell by 48%, from 22.4% to 11.7%.
Senator Anwar is going to delay not doing the comment, and I really appreciate that. Any other comments right now with Mr. Johnson? Thank you very much for coming. Appreciate it.
Thank you very much.
Up next is Jody Terranova from the Department of Public Health, the Deputy Commissioner. The floor is yours.
Thank you. Good afternoon, Senator Austin, Senator Anwar, Representative Walker, Representative McCarthy-Vahey, and distinguished members of the Appropriations and Public Health Committees. I'm Dr. Jody Terranova, Deputy Commissioner at the Department of Public Health and one of the governor's appointees to the Tobacco and Health Trust Fund Board. Thank you for the opportunity to testify today in support of the allocation plan that is before you. As we know, addiction to tobacco and nicotine poses a significant health risk. Tobacco is the leading cause of preventable disease, disability, and premature death in the United States. In Connecticut, we've already heard approximately 5,000 people die each and every year from smoking-related causes. Currently, 17% of adults in our state use tobacco or nicotine products on a regular basis. That's about 500,000 people. And about 5% of adults are using electronic vaping devices. Among our youth, 11.2% smoke or vape, 10% vape, 1% use traditional cigarettes. To Rep. McCarthy-Vahey's point, this is a new area that we need to focus on. And girls are vaping at twice the rate of boys. 14% of teenage girls compared to 7% of teenage boys. So we really need to focus our efforts differently. And health disparities exist. Tobacco use is disproportionately higher among Black and Hispanics, in the LGBT community, individuals with low socioeconomic status, and those with mental illness. There is continued work to be done to decrease the harms of tobacco and nicotine, to prevent youth from becoming addicted, and to help teens and adults quit when they're ready. 7 out of 10 smokers say they would like to quit, and we want to be here to help them. The allocation plan put forward by the board follows the CDC best practice guidelines for comprehensive tobacco control program. You've heard about the 5 key areas in this best practice plan. They are the state and community interventions, where a lot of the prevention work is focused, the communications, cessation interventions like the quit line, 1-800-QUIT-NOW. We also have a texting option really focused on vaping. You can text vape-free CT to 88709 and get help quitting vaping. It's a surveillance and evaluation area where we're going to verify that the money being spent is spent wisely on evidence-based practices. And that 5th area for infrastructure and administrative support to fund the people to do this work. As the newly reconstituted board held its first meetings in the summer and fall, the Department of Public Health provided an overview of the CDC best practices so that board members had a clear understanding of these category areas and the percentages that were recommended for each category by the CDC. These categories work synergistically with each other to create that comprehensive plan, a plan that addresses the 4 goals outlined in state statute and aligned with the national tobacco control program. That's preventing people from starting, helping people to quit, eliminating exposure to secondhand smoke, and identifying and eliminating disparities. The board unanimously supported this allocation plan, and I hope you will too, and I'm happy to take any questions that you have.
Thank you very much. Representative Walker?
Thank you, and thank you for your testimony. I'm going to ask about the administration, 525,000. It was said that there were 2 people that were there. My first question is, do you have other settlements or other things that pay for your administration similar to this in grants that you have now?
Yeah, so we do have a grant from the CDC, about $1.17 million that we get each year. A small portion of that funds the quit line, and the majority of that funds staff, and then some goes to programs as well. So we have 4 people right now in our tobacco control program. 3.6 of that FTE is funded through the CDC dollars.
Okay, so the money that the 525 is for proposals, awards, contracts, modifying existing contract. I would sort of, I guess that's what I thought DPH did. So that's why I didn't realize that a major portion of your staffing is paid for by outside grants and things. If this grant disappeared, would those positions disappear?
They would, yeah. So currently CDC, as part of their best practices, they recommend essentially 7 positions to fund kind of that full comprehensive plan. We're slimmed down, we have 4. So we have the director, we have someone that's kind of doing communications work, one that's focused on youth prevention, and one that's our cessation coordinator. So the other pieces that are missing is kind of that fiscal component. So we don't really have anyone specifically working on like the fiscal and contract pieces. There's also administrative support and policy coordinator that's recommended by the CDC. So there's some gaps in our program that are recommended as part of the best practice. So we would look to kind of fill some of those. The 525,000 comes out of that percentage where it's kind of like out of the big piece of pie, 4% is recommended to go to infrastructure administrative and management support. So that's where that 525 number came from. It didn't necessarily come from DPH saying we need 2 positions or 3 positions, and this is what it would cost.
Okay, I have just 2 questions, so I've already asked my 2, but I guess I'm just a little concerned. I hear the voices of my colleagues and the voices of some of the advocates that we have agencies that do get these grants, and we're glad they do, but part of their job is to manage these grants when they go and apply for them. So applying the dollars as much as possible to the actual services, I think is what we're hearing a lot of. So I really, all right. Thank you, Madam Chair.
Thank you. Senator Berthel?
Thank you, Madam Chair. Deputy Commissioner, thank you for your testimony today. I'm a little bit disturbed by the numbers that you shared regarding the increase in youthful use of vaping products. I don't know if you have it before you, but if you could convert that percentage into the number of people,
Sure.
that would be very helpful. And I guess second to that is, and it's probably also not something you might have in front of you now, but I recall in the last 10 years here that we actually saw a meaningful decrease in the use of tobacco products among youth. And now I know this number is higher in terms of what you spoke to with vaping. And I'm wondering if you might be able to, if it's not too much effort, to share how that has changed, provide some data back to the committee. Clearly, I think what we're seeing the effect of here is maybe some nefarious actors out there that are selling vape products, perhaps not in traditional places where individuals might buy tobacco products. And I know that that's not a secret or anything. I see it in many of the towns that I represent as well. So perhaps we have to collaborate with DCP and with law enforcement to actually put these people out of business, if you will, because it seems like the increase shouldn't be happening if we're doing all the right things within the the ability of this fund to reduce tobacco use. So if you could provide that data at your convenience back to the administrator regarding that youthful use and the changes, that would be very helpful.
Absolutely. And the number of high school students is 17,600.
Okay,
So,
thank you, Madam Chair.
And our data is available on the website, the youth school survey, that'll show those trends, but we'll send it to you directly as
thank
well.
you. I
But just
forgot
for
about
the
that. Thank
public to know that that's where that information comes. Every 2 years, we survey students in high schools across the state and get that information.
Thank you very much. I
Thank you.
appreciate that. Thank you.
Thank you. Up next is Representative Harrison.
Thank you, Madam Chair, and I will be quick. I don't really have a question. What I'd like those of us sitting here to understand, and I really want to thank you, Deputy Commissioner, as well as Claudio. The board got reconstituted, and boy, we got to work. We had monthly meetings. They were engaging. A lot of questions were asked, and we do realize that we are missing some data that's very pertinent to us to continue to make our decisions. And I want to say that all of us are beyond happy, I think, to know that we could bring something forth this quickly to this group. And I want to commend both of you for the work that you did to help us get to this point and to do it that quickly. So thank you.
Thank you.
Thank you, Representative McCarthy Vahey.
Thank you, Madam Chair. 2 questions. Thank you to Deputy Commissioner. To Senator Berthel's point, enforcement. Does the state and community intervention money include any enforcement? And if not, where does that enforcement lie?
Yeah, so DPH does not do enforcement. The one area where that state and community intervention work could be done is reaching out to individual sellers and talking about product placement and making sure that it's not necessarily being in places that are visible and most attractive to youth is one of the goals.
Thank you. Thank you for outlining that. I think it gets confusing in terms of how it works between DRS, DCP, and DPH and the different roles. The second question that we heard from Bright Johnson, who's a great advocate about the research dollars in other states. is there research or the invested dollars in other states? Is there research that shows a causal link between the dollars spent on those interventions and the numbers declining? Or is that a correlated effect? And can you help us with that? For example, tax policy over time with cigarettes as an example.
Yeah, I don't have that information right in front of me. I think I'd have to get back to you on that.
Thank you.
Yes,
Thank you, Madam Chair.
Thank you. Representative Dathan for 2 questions.
Well, we'll get two because Rep. McCarthy Vahey asked one of my questions. So, just wanted to understand, does DPH invest money in things that are known to be epidemics in our country?
Do you have something specific? You mean like,
Well, I just understood that vaping has been declared an epidemic by the CDC and others in 2018. And I'm just wondering, what is the approach of DPH in investing in epidemics to prevent people from either getting sick or dying?
yeah, so a lot of our work really is focused on epidemics. And really we have had for over 20 years the tobacco control program at DPH. And so even before this declaration, we have been working on this, and we have been working on vaping in particular since it came on the scene. But being able to have more dollars to go out into the community to focus on this would certainly be well received.
Does the CDC recommend how money is allocated, whether it's to prevention, cessation, or education, as part of their recommendation that we should be spending $32 million a year?
They do, yes. Part of their plan has those kind of 5 different categories called out, and then the percentages that should be allocated to each category. So they do provide that recommendation. And so what we've done here is applied that to the $12 million. So it would be broken down along those same percentages, but still allow there to be funding in each of those categories. Because as I said, it's really an integrated approach. So we don't want to fund just one of them because they work best when they're all funded.
Got it. Thank you very much. Thank you, Madam Chair.
Thank you.
Thank you. Okay, I see no other questions right now for you. You're all set.
Thank you very much.
Up next is Mr. Williams, American Heart Association, Government Relations Director. You have to turn on that mic right in front of you, sir. Thank you.
Better this way?
And I'm going to remove those little lights in front of there because can't see you. So go ahead.
Sure. My name is Jim Williams. I'm the Government Relations Director for the American Heart Association. I'd like to thank the leadership and members of the Appropriations Committee and Public Health Committee for providing me with the opportunity to make comments here today. And just to say how nice it is to be here today. It's taken years to get to this point. Today marks the first time since 2015 that the legislature has had an FY Tobacco and Health Trust Fund allocation plan to review, which will hopefully be approved. The legislature approved $12 million in 2022 and again approved the same amount in 2023. It has taken some time to reconstitute the trust fund board, which awaited appointments from numerous leaders. The $12 million approved in 22 is what we are here discussing today. The second $12 million approved by the legislature in 23 becomes available in April of this year. This process has certainly taken some time to get back up and running, but it is finally doing so now. We feel strongly that any allocation plan closely follows current CDC best practices, as they are tried and true actions in preventing and reducing tobacco use, which we feel this plan successfully does. However, as you are aware by now, I'm sure the governor's current proposed budget sweeps the annual $12 million for FY25 back into the general fund. Any successful program relies heavily on continuity of funding, which is why we cannot simply allow these funds to be swept again back into the general fund, especially now when the program is finally getting back up and running. Tobacco control in Connecticut, in a sense, should be viewed as self-funding, as Connecticut takes in approximately $367 million every year in tobacco product sales revenue and annual disbursements for the Master Settlement Fund, which are paid out in perpetuity. The CDC recommends that at a minimum, Connecticut invest $22.7 million annually on tobacco control. Ideally, Connecticut should be spending $32 million according to the CDC. Currently, there are two bills to address this minimal recommendation in the Appropriations Committee that I hope you will consider not only supporting, but also signing on to. Thank you very much for your time. I'd be more than happy to answer any questions that you may have.
Thank you. Are there any comments or questions? Seeing none? You are all set, sir.
Thank you.
Up next is Ruth Canovia. Ruth? Oh, hi, good. How are you? Floor is yours.
Hi, good afternoon. My name is Ruth Kenobi, and I am the Director of Advocacy for the American Lung Association in Connecticut. I really want to thank you for the opportunity to express our strong support of the Tobacco and Health Trust Fund Board's recommendations for allocating these $12 million in funding tobacco cessation and prevention programs. I really want to thank you for championing the establishment of this board, and for your support in the vital investment in public health over the past few years. I know it took some time to get these appointments going, but those of you who attended the meetings once they got started saw the serious way in which the board members approached their work and the thoughtful way they decided how to allocate these funds. You see these recommendations before you, and I do want to commend the board following the CDC best practices in terms of types of allocations and proportions, from state and community interventions to cessation and health communications to surveillance, evaluation, and administration. These are all necessary elements of a successful campaign to prevent kids from addiction to these deadly products and to ensure people who are ready to quit have the proper resources to do so. You've all probably heard me say this before, but the investment to prevent young people from getting hooked on nicotine and helping those who are already addicted to quit saves lives. It saves lives, but it also saves money. A study conducted by the University of North Carolina, which was already referenced today, said that Connecticut saved $2.48 for every dollar invested in current tobacco control programs. And there's real opportunity here. Bright, my colleague at the ACS CAN, mentioned this, but there was new data that came out of California in the last year that said that when they sustainably invested robust levels, they actually had returns on their consistent investments as high as $155 to $1. Significant. So with that sentiment, I really appeal to you to approve these recommendations and encourage the Tobacco and Health Trust Fund board to keep doing its diligent work. Please don't let the slow start of the Tobacco and Health Trust Fund, like all of these appointments, kind of set us back on the progress that we can make and when we really invest sustainably. So keep up the good work is basically what I'm trying to say. Keep investing in this. I know we've got some really great champions here, and so I want to thank you for that, and ask that you consider even increasing these dollars because they can make a real difference in our state public health.
Thank you. Senator Anwar has a question.
Okay.
Thank you. American Lung Association recently gave some grades to the state of Connecticut. Could you share them with us, please?
I can. And so we have every year it comes out state of tobacco control. And so there are areas, and I don't have my notes in front of me, so you're really testing me on my memories here. But there's areas that are kind of considered best practices, right? And kind of what we know policies make the most sense. And so the funding one, we talk about Connecticut gets an F for our funding efforts. And I think that's no surprise to us. It does measure us on that number that you keep hearing in terms of the $32 million annually. But when we ask for us to invest, but really what I think is so important is the sustainability of these investments, not doing start and stop. So appreciate the 12 million, love to see getting us up there as well. We look at flavors, whether or not we've enacted a flavor prohibition, and we get an F there. But we do some great things in Connecticut. Claudio mentioned our investments in making sure that people on Medicaid have access to cessation services. And so when we look at our access to cessation services grade, you're really going to test me, but I think it's a C. But again, we get hit because for people who are uninsured, that quit line service is the only source that they have. And when we're not investing in the quit line, that can be really challenging. Indoor air, we get a B because we have something called preemption, where towns and cities can't make their own laws kind of increasing those rules and regulations. And then finally, tobacco taxes, because we actually have the second highest cigarette tax in the country. The only reason we get a B is because we don't have what's called tax parity for other tobacco products. So while we have really high rates for cigarette taxes, when we look at our taxation rates for e-cigarettes and other tobacco products, they're not taxed at the same rate, which, you know, the Lung Association would like to see changed. Thank you.
Thank you. Up next is Representative McCarthy Vahey.
Thank you, Madam
Yes.
Chair. Thank you, Ruth. You
Oh,
heard
thank
my
you.
question to Deputy Commissioner Terranova. You referenced the UNC study,
Yes.
and it sounds like that's some of the data that would be helpful for us. And if you could share that with the committees, that would
Absolutely.
be wonderful. Thank
Yep.
you, Madam Chair.
Thank you. Any other questions right now? Seeing none, you are
Thank you
all
for your
set.
time.
Up next is Ingrid Gillespie, Liberation Programs Director of Prevention.
Hi, good afternoon, distinguished chairpersons and members of the Appropriation Committee and Public Health Committee. My name is Ingrid Gillespie. I'm Director of Prevention and Liberation Programs. We're a large behavioral health agency with services from Bridgeport down to Greenwich. And I'm also co-chair of the Stamford Local Prevention Council and a member of MATCH. I really have been involved with the Tobacco Health Trust Fund advocacy efforts since I started doing this work about 20 years ago. And so very familiar when Bright talked about the number of times that this fund has been, I'm going to say dipped into, but money's been taken out of it. And I'm also familiar now, more so in the last 3 years, done a lot of work around smoking cessation supports for those living with mental illness and substance use disorders in youth. And we really support the Tobacco Health Trust Fund plan in terms that it does follow CDC best practices. Definitely will help on the local level, the RFP process for going out for projects that display best practices, even if every town's not going to get it, which I totally advocate for. The results I'm hoping will be things that will be transferable to other communities. But I agree with Ruth and Bright in terms of the sustainability. My concern is that evaluation will show a program is there. If we look at any prevention programs and you look at what factor contributes to their effectiveness, sustainability is right up front. And the other thing that's happened in the last 2 years, and I think Representative McCarthy Vahey alluded to it, was that our environment has changed in the last 2 years substantially. We are not just dealing with the messages through social media. We are now dealing with the messages that are seen in every community in concentration through the smoke shops and increase in tobacco retailers. There is some crossover where tobacco health trust funds could be used. Example, merchant education. There was a bill proposed and the Commissioner Demas and I think DCP both liked the idea of mandated tobacco merchant education, but there was no funding to do it. So I think there's crossovers where we can look at not just supporting what we call in prevention, the frog, the individual, but also the pond, the environment. So these tobacco health trust funds are a critical piece of a multi-strategy approach. But our landscape is changing, and to some of the comments that I heard from representatives, it really is an uphill battle, and sustainability consistency is critical to this. So thank you for the opportunity to share some thoughts. Thank you.
Thank you. Any comments or questions? I have one question for you relative to those who are on the mental illness
right
side of things. And for context, I worked in the Department of Corrections for 21 years and saw a number of increased mental health incarcerated folks coming in. And one of them was the non-compliance of their ability to take psychotropic medications. Either they were not housed correctly, or they were just non-compliant with that. And a lot of them used some tobacco products to ease their symptoms. Based on the work that you do, have you seen that to be a factor in not substance use disorder, just mental illness? Have you seen that as a complication in the use of tobacco-based products for people who have mental illness?
When I did this a number of years ago, because it did come up, at that time, there were, our researchers showed that could be a complication for a handful of people with serious mental illness, but we offset that with other NRTs and options for individuals. And we had numerous examples, Senator Elston, of people with serious mental illness who were able to successfully quit smoking. And again, it went back because we actually had some Tobacco Health Trust Fund dollars at that time. So, yeah.
I would be interested in the data that you have on that, if you could send that into the administrator, because I think that that's something that's important to look at, in particular because we don't have enough mental health professionals relative to dealing with this issue. And I'm really concerned that without those other factors helping out, that we are setting up some people for failure relative to their mental illness and the consequences that exist as a result of that.
I will send you what we have. Thank you very much.
Thank you. Any other questions or comments? Seeing none. Up next and last is Jane Reardon. You have to turn on your mic, ma'am. The red button there. Thank you. Go ahead. Yep, Claudio, thank you.
Thank you, Claudia. Okay, can you hear me? So again, good afternoon, distinguished chairpersons and members of the Appropriations and Public Health Committees. My name is Jane Reardon. I'm a pulmonary clinical nurse specialist for 45 years and a longtime volunteer for the American Lung Association. I am truly, deeply committed to the American Lung Association's mission, which is to save lives by improving lung health and preventing lung disease. I'm here today to express support of the Tobacco and Health Trust Fund Board's recommendation for allocating $12 million from fiscal year 2023. I first want to thank the Tobacco and Health Trust Fund Board for your thoughtful consideration about how best to allocate the much needed funding for tobacco prevention and cessation in the state. Tobacco use remains the leading cause of preventable death and disease in Connecticut. Every day, I see the negative impact tobacco has on our Connecticut residents. As a nurse for many years, I've worked with people who are addicted to tobacco products, who are motivated to quit, but lack the resources to do so. Many continue to smoke despite knowledge of its effect on their failing health. I watch as my patients struggle for breath, even when they're at rest. They can no longer participate in work and family activities that bring them joy. Most of them desperately want to quit smoking, but lack the resources to do so on their own. They are not weak or unmotivated people by any means. These people who become addicted to a legal product that has been peddled to them by an industry that spends billions on clever marketing each year. Quitting using tobacco can be one of the most challenging things a person does in their life. Helping to prevent youth from ever starting down down the path of tobacco addiction would be an incredible success. The 2023 National Youth Tobacco Survey found that high school tobacco use did decrease in the past year. However, it has also found that middle school students' use rates increased 50% in the same time frame. I'm very concerned about addiction rates among youth, as this same survey found that 25% of youth are using tobacco products daily. These youth rates are very high. We must do more to protect youth from this horrible addiction. Lastly, tobacco takes a huge toll on our state, and I appreciate having the opportunity to talk about reducing the burden of tobacco use we see day in and day out. I urge you to approve these recommendations from the Tobacco and Health Fund Board and encourage you to reject the proposed suspension of the FY 2025 transfer of funds from the Master Settlement Agreement to the Tobacco and Health Trust Fund, and consider dedicating at least the minimum annual investment recommended by the CDC. Thank you so much.
Thank you very much. And we let you go beyond the 3-minute time frame in honor of your 45 years of service.
I am slower, I do have to say.
I don't think you're slower.
But just as committed.
I do not think you're slower, so I think you're fine. Any other questions? Seeing none? Thank you very much. I have one question for Claudio, if you wouldn't mind coming back up
Okay,
for
thank you.
clarification.
Thank you. Have a good day.
Claudia, we've heard a lot about, this is FY 23's allocation here. And FY 24's allocation plan is due in April of this year. Will you have a plan to us in April of this year for us to codify?
No, Senator. So what the plan is that this is sort of phase 1 of the process. So once you guys give the blessing or give us an amended plan, we can then begin operationalizing it. We want to take inventory of what we're getting as feedback. Another key point is that the CDC is going to update its best practices categories in the next few months. We've been working off the 2014, and we want to wait for that new guidance to come out to see if there's any changes before a lot.
So, relative to that, when would you have a plan in front of us for FY 24?
Probably a year from now.
So you're planning on taking another full year to get that done. I would suggest that we get a plan no later than January of next year. I think that a full year is far too long. We need to get back on track. Because quite frankly, the legislature has not agreed to the governor's plan of sweeping the FY 25. And I'd rather us get a plan in. I'd actually like to see us get a plan in October of this year. But I'm not certain if we can vote on a plan. We do vote on spas when we're not in session. So I'm thinking that we may be able to vote on this plan. So I'd really like to see us come back in October of this current year and vote on a tobacco plan, and then get back on track for April of next year, should the legislature not agree to the sweep, which right now I'm not saying whether or not we are not at that point, but I want to give us at least the flexibility to do so. So I don't want to push things off for another year. So that is my recommendation, is that we come back in October to do something, and then as long as Madam Administrator tells me that we're okay with that, she says, yes, we're okay with that. So if you wouldn't mind that, and I think that you might get a letter from the chairs and ranking members of the 2 respective committees to come back with a recommendation in October. So I just wanted to find out sort of the practice and policy. And I understand that you want to see what the CDC is going to do, but if we get back on track, we have time to address the CDC's questions and concerns. I don't know what anybody else has.
Yeah, well, Senator Austin, I know Representative Harrison pointed out the board is committed to doing this expeditiously. And if we're given the direction that it's sooner rather than better, than later, then the CDC new recommendations should come out in the next few months. We can take inventory of where the RFP process at DPH and certainly
Okay.
put forward a plan at your pleasure when that's appropriate. We can do it in as quick as 3 months, right, Representative Harrison? We did it in 3 months this time, so we could do it.
So good, then we'll get a letter together from the chairs and ranking members of the committees to make a recommendation that we get something back in October.
And
Okay,
if it would be helpful, maybe we take stock of where we are in the summer in the RFP process to see what the level of interest is, if that would be of interest to you.
I love you, Claudio, but I am not waiting that long to come up with a recommendation. So I think that that's something that we're gonna put a letter together and we'll talk amongst each other.
My admiration of you is equally as great, Senator.
Representative.
I would like to second her ask there as ranking member. You don't even need a letter.
Thank you, Representative Nuccio. Representative Harrison.
So I think we can agree to that. And I can see the deputy commissioner and Claudio saying yes. And I have another board member sitting out here shaking his head yes. So I think we can get it done.
Okay, great. Thank you. No other questions. So I'm going to end the public hearing right now, and we need time to get everybody in from other committees. So we're going to give ourselves a 5-minute break, and then we'll be voting on the plan. Okay, 5 minutes from now, that'll put us at 3:06. So you can use the respective restrooms. Come back. So, if everybody wouldn't mind taking their seats and, for the respective members of the different committees, if you wouldn't mind calling your membership to have them come online or in person over here, please. We are going to get everybody back in order here. So if you have colleagues that are in different meetings, please get them over here because votes will not be left open. They will not be left open.
I know I said yes.
So I'm going to turn this over to the Public Health Committee Chair. Ma'am?
Thank you very much, Madam Chair. We are now convening a Public Health Committee meeting, and we would like to have a motion to approve the fiscal year 23 Tobacco and Health Trust Fund Allocation Plan. May I ask for a motion?
So move.
Moved by Senator Anwar, seconded by Senator Summers. Is there discussion among Public Health Committee members on this item? Is there discussion on this item? Seeing and hearing no discussion on this item. Mr. Clerk, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks,
Senator Marks votes yes.
Representative Parker,
Representative Parker votes yes.
Senator Summers,
Senator Summers votes yes.
Representative Claire Ditria,
Representative Claire Ditria votes yes.
Representative Belton,
Representative Belton votes yes.
Representative Berger Giovanni, Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné, Representative DiCaprio,
Caprio votes yes.
Representative D'Amico, Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Jenga,
Representative Jenga votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan, Representative Mara,
Representative Mara votes yes.
Representative McCarty,
Representative McCarty votes yes.
Representative Palm, Representative Perillo, Representative Rader, Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
I'm trying to unmute. Reddington Hughes votes yes.
thank you. Representative Ryan,
Representative Ryan votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terziak,
Representative Tursiak votes yes. Thank you.
Representative Welander, Representative Zupkis,
Zupkis votes yes.
I saw Representative Berger Giovanni,
Berger Givallo votes yes.
thank you. do a second call.
Mr. Clerk, may I cast my vote? Representative D'Amico?
Votes yes.
Representative D'Amico votes yes.
Okay,
Thank you, Mr. Clerk.
I got you. Okay, I'll do a second call.
Yes, as well.
Thank you, Mr. Clerk. I believe,
Senator McCory votes yes.
Senator, we are just voting in the Public Health Committee now, so
Oh, I'm
just for
sorry.
those who are still trying to log in,
Mhm.
because votes are not being held open, I believe there are a couple other members of the Public Health Committee. The clerk will call back through the roll of those who were not able to vote the first time around. Mr. Clerk.
Senator Cabrera, Representative Dauphiné, Representative Elliott,
Elliott votes yes.
oh, got you. Thank you. Representative Linehan, Representative Palm, Representative Perillo, Representative Rader, Senator Slapp, Representative Welander. Thank you, Madam Chair.
I think some of the people are having technical issues, so. Can you give us one more second? We're getting texts that they're.
Mr. Clerk, yes, if you would just hold for one moment. Thank you. Mr. Clerk, I believe that Representative Linehan has entered the Zoom room and would be the last person, I believe, to be able to vote.
Representative Linehan,
Representative Linehan votes yes. Thank you.
I believe Ann Dauphiné is trying to get on as well.
Thank you very much, Representative. I see Representative Dauphiné, Mr. Clerk.
Representative Dauphiné,
Dauphiné votes yes.
Thank you, Mr. Clerk.
thank you, Madam Chair.
Mr. Clerk, if you could take a moment and kindly announce the tally.
Thirty-nine voting yay, 6 absent not voting. Thank you, Madam Chair.
Thank you very much. And with that, we are in recess.
Thank you very much, Madam Chair of the Public Health Committee. The Appropriations Committee convenes the meeting for the FY 23 Tobacco and Health Trust Fund Allocation Plan and asks for a motion.
So moved.
Moved by Representative Walker, seconded by Senator Berthel. Is there any discussion? Seeing no discussion, the administrator could call the roll, please.
Senator Austin,
Senator Austin votes in the affirmative.
Representative Walker,
Representative Walker votes the affirmative.
Senator Hartley,
Senator Hartley in the affirmative.
Representative Exum,
Representative Exum votes yes.
Representative Paris,
Representative Paris votes yes.
Senator Berthel.
Good afternoon, Madam
Good
Administrator.
afternoon, sir.
Senator Berthel votes yes.
Representative Nuccio.
Hello there. Representative Nuccio votes yes.
Hello.
How are you?
It's nice to see you.
Nice to see you too.
Yay.
Senator Anwar votes yes.
Thank you. Representative Baker,
Representative Baker votes yes.
Representative Belinsky,
Representative Belinsky votes yes.
Representative Callahan,
Representative Callahan votes yes.
Representative Candelaria,
Representative Candelaria votes yes.
Representative Chalesky,
Representative Chalesky votes yes.
Representative Curry,
Representative Curry votes yes.
Representative Dathan,
Representative Dayton votes yes.
Representative DiCaprio,
DiCaprio votes yes.
Representative Delaney,
Representative Delaney in the affirmative.
Representative Delnicki. Yes. Representative Dillon,
Representative Dillon votes yes.
Representative Felipe,
Representative Felipe votes yes.
Representative, oh, I'm sorry, Senator Flexer,
Senator Flexer votes yes.
Representative Fonsello,
Representative Fonsello votes yes.
Representative Garibay,
Representative Garibay votes yes.
Representative Gibson, Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Gonzalez, Representative Haddad,
Representative Haddad votes yes.
Representative Hall, Representative Harrison,
Yes.
Representative Hoxa,
Representative Hoxa votes yes.
Representative Johnson, Representative Khanna,
Representative Khanna votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser,
Senator Lesser in the affirmative.
Senator Marks,
Senator Marks votes yes.
Representative McCarty.
Representative McCarty votes yes.
Now it's your turn, Senator McCrory. Senator
The-
McCrory.
And Senator McCory votes in the affirmative. Thank you, Susan.
Thank you, sir. Representative Nolan,
Nolan in the affirmative. Thank you.
Representative Porter,
Representative Porter votes in the affirmative.
Representative Osborne,
Osborne votes yes.
Representative Reyes,
Representative Reyes in the affirmative.
Rosario.
Rosario in the affirmative.
Thank you. Representative Ritigliano, Representative Ryan,
Representative Ryan votes yes.
Representative Sanchez, Senator Slapp, Representative Sims,
Sims votes in the affirmative.
Senator Summers,
Senator Summers votes yes.
Representative Tersiak,
Thank you. Representative Tersiak votes yes.
Senator Winfield.
Senator Winfield in the affirmative.
Thank you, sir. Representative Zalastowski.
Representative Zalastowski votes yes.
Has Representative Gibson joined us? Representative Gonzalez, Representative Hall, Representative Johnson, Representative Rutigliano, Representative Sanchez, Senator Slapp.
Can I just say go Huskies?
No. Madam Administrator, please announce the tally. And Representative Palm, the votes for public health were already taken and we cannot go backwards, so I apologize for that. I refer you to Representative McCarthy Vahey.
Thank you. I tried to pull my car over in time. I apologize.
No, it's not your fault. Madam Administrator?
Well, Madam Chair,
Yes.
since I've not yet announced the tally, Representatives Gibson and Johnson have jumped on. So may I call them?
Yes, you may.
Representative Gibson,
Representative Gibson votes yes.
Representative Johnson, Representative Johnson.
Hi, can you hear me?
Yes, ma'am.
Okay, I vote yes.
Thank you.
Thank you.
Okay, now I'm ready. You ready for me?
I am ready.
All right, total number voting 48, those voting yea 48, those voting nay 0, those abstaining 0, those absent not voting 5.
So motion is passed, the plan is passed, and the Appropriations Committee will take a motion to adjourn their meeting. Representative Walker, seconded by Senator Anwar. All those in favor indicate by saying aye.
Aye.
I now turn this over to the Public Health Committee.
Thank you, Madam Chair. We would like to adjourn this meeting. Moved by Senator Anwar, seconded by Senator Summers. All in favor?
Aye.
We are adjourned.
Okay, we're done. Thank you. Thank you, Madam Administrator. Thank